We're on. Good morning, everybody. This is Ray Turner with Turner Real Estate, and our special guest today is Dr. Rucker of Rucker Integrative Medicine. Good morning, Dr. Rucker.
Good morning. How you doing there, Ray?
Good, good. Great to have you on the show. I thought I'd start with a little backstory. I was seeking to optimize my health through supplements and through diet, and came across Dr. Rucker, and thank goodness I did. So I've been a client of his for years right now. And then, what I wanted to do is, as we're aging out, is try and figure out ways to optimize and then also overcome, say, the weaknesses in our immune system and things like that. Maybe you could speak to that first, Dr. Rucker.
Sure. I maybe just to give the quickest bit of background is I am a medical doctor, and I perform surgery in the field of urologic surgery for 10 or 15 years, and then I branched into holistic integrative care. One of the big reasons I did that is I would meet patients in my old practice where they'd have a complaint, and if it didn't fit the urologic diagnosis, we just shoo them away. So the lead in to answer your question is I started to look at the whole picture, the whole patient. So even as a urologist, if you saw someone with urinary tract infections, the answer was, here, take this antibiotic, see you later. Instead, I learned to start looking at the whole patient and the immune system. So I started seeing the body's made up of several systems. So when it comes to balancing the immune system, my fundamental approach for these things is certain supplements, nutrition, exercise, even taking care of the mind and body. So in a nutshell, those are some of the principles I follow. Now, I'm sorry, Ray, go ahead.
Oh, no. Would it be fair to say, like, the regular medicine, the way I look at it anyways, regular medicine, we're kind of treating the symptom, let's say. So, hey, you've got this symptom, we're going to give you a pill for that, and then it causes side effects and everything else. Whereas your style of medicine is really treating the cause, and then there's natural ways to go about that. Would that be fair?
Absolutely.
Fair assessment?
I 100% agree with that assessment. And one of the pitfalls of regular medicine is, let's say you come in with a skin rash, they give you a steroid. That just suppresses the immune system and gets rid of the rash, but it causes a whole host of other problems when you're not trying to fight. Let's say that was caused by eating the wrong foods, or even stress can cause a lot of problems. So instead of just giving a steroid, I'd rather see someone's immune system get balanced.
Right. So what's a few tips on the immune system then?
One of the basic, simple tips that I give to all the patients comes from one gentleman who happened to win 2 Nobel Prizes, which is very rare. That gentleman's name was Linus Pauling. Dr. Pauling made the use of vitamin C very famous. Sounds like a wives' tale maybe, or a husband's tale. I'm trying to be very, neutral here. So Linus Pauling suggested vitamin C was very effective for the immune system, and that is the case. So I ask my patients to learn to take vitamin C. The dose can be anywhere from 2 grams a day to 5 grams, and the only limiting step there would be diarrhea. In the IV form in my office, we give up to 60 grams. So it depends on what condition the patients are fighting. Another big time immune agent I teach patients to utilize is vitamin D3, the sunshine vitamin. A lot of patients say, why not just get in the sun? Well, the problem is in Florida, we can't get enough sun to get the vitamin D levels that I like to see the patients have in their blood work, which would be in the order of 80, 90, even 100. So you would have to spend 8 hours a day sunbathing nude. And the irony is, the darker your skin is, the more you can tolerate that, but you won't absorb as much. So vitamin D3 along with K2 is an oral supplement that I recommend to patients. And another immune boosting agent is colloidal silver, but it has to be very, very specific, certain types of colloidal silver. But those are just a couple examples to share with people.
Yeah, I know that, outside of you being my doctor, I'd done some homework on the vitamin C as well. And actually there was federal studies on its benefits. And the fact if it's going intravenous, you can't really overdose on it and things like that. So there's actual federal studies as well.
You're absolutely correct. The irony is Dr. Pauling was very upset because when they did studies testing his data, his data was based on high doses through IV use, and the studies the federal government did was very small doses orally. You just can't randomly compare things like comparing a moped to a Harley Davidson.
Right.
The right system to do the comparison.
Was that an analogy for me?
Yes, because I love mopeds. I mean, Harleys.
That's right. So tell me a little bit about ozone and some of the other things that you do. So there seems to be a lack of understanding of ozone, but it's really good.
Oh yeah, excellent point. What's super cool about ozone is there's a lot of very well-to-do people in terms of politics and things like that who have rumored to have used it, including Ronald Reagan and the Queen of England. Despite if you like them, they had access to the best things in the world. Now, it was originally created in the United States by Dr. Harvey Kellogg, the cereal guy. He was a doctor in Battle Creek, Michigan. Then Tesla made the most generators, but the AMA and the powers that be, probably Edison too, they wanted to see him destroyed. But it shows you the level of genius behind this. So what it is oxygen. O2 normally is 2 of them. Ozone is chains of 3, 4, 5, all the way to 12. When they split, that charged oxygen that has an electron there, which it donates the electron, that causes immense healing in the body. I have probably 100 videos on YouTube, easy to find, but I use it on pro athletes, on weekend warriors, you name it. Injecting into muscles and tendons has profound healing aspects, and I also inject it into the bloodstream in different ways to help my advanced cancer patients. So ozone has profound effects for pain, regeneration, and immune system building.
Yeah, that's interesting, even for cancer then.
Yeah, it's an absolute cornerstone hallmark. Another guy that made it very famous is the gentleman, Dr. Atkins. Dr. Atkins was a very famous integrative doctor. Most people only know him because of the Atkins paleo diet and all that stuff. He passed away. I think he actually fell on the icy sidewalk or something and died in New York one time. But he was a profound user of ozone in the United States. So there's just a long track record of smart doctors who learned to come off the beaten path and use these very, very great techniques that are not patentable, so they don't get widespread play and use in the conventional world. But when you come into offices like mine, where I'm really only paying attention to what is the best bang for the buck that I can get for my patients, not what some corporate interest representative handed to me as a sample. See, it's a different motivation.
Right. Well, you're bolstering your own system versus taking a med, right?
Well, you nailed it. That's a funny thing you say that word. A couple of the people that I really admire in medicine suggest that we are using systems-based medicine. So it's looking at different systems and putting a system into play to fix different systems. And I even mentioned to you, if we had time, I was going to mention the symphony analogy. I tell the patients, they come in, let's say you come in with fatigue. The patient says, "Hey doc, I heard bioidentical hormones help. Can I get some testosterone, or if it's a woman, could I get on progesterone and testosterone cream? Because these hormones are beneficial for both sexes." I tell them, that's great, I could do that, but your body's like a symphony. I have to look at each section or each system. So if I just look at your androgen or steroid system, that's only one part. Another system is the thyroid. Another system is, let's say it's emotional well-being. If your partner comes and yells at you every day and puts you in the corner and makes you feel terrible, that affects your immune system. So I actually believe the holistic system is like a symphony. We have to have every section tuned for the whole symphony to sound beautiful. So that's how I look at it and teach people.
Yeah, that's awesome. And it's been quite an education being your client, actually. So you actually have a great way of explaining all of those pieces. And when something gets a little bit out of whack, we've got a natural cure for getting there.
Yeah, I think with motivated patients, I find my ability to help them, because I tell them, we sit at a table, maybe family members, I say, we're a team. I'm just on your team. You're the head coach. Maybe I'm the GM, and we got linebackers. So we all function as a team. When we do that, I find we're solving 98% of very difficult to solve issues. Because you think about it, look at friends or anyone you heard of, when people complain of fatigue, depression, the fibromyalgia, chronic illness, GI problems, you know, for the past 10 years, you go, wow, that's probably a tough one. Well, it's really hard on the conventional doctors. And still, we find 98% success rates getting patients a lot better. So I'm pleased to see these systems work.
Well, we do seem more susceptible to all of those symptoms, right? The lack of energy, the lack of clarity in our thinking, and all of those things. So to optimize it, like you said, if that symphony's in sync, then as we age out, we can kind of maintain those things. I mean, even for myself, we discovered a reason why my thyroid was out, so my energy levels were lower, where I feel like I need a nap in the afternoon for the first time in my life. But something got out of whack.
Yeah, and that's the overlooked master gland of the body, the thyroid. It controls so many different things in life. And another thing that's worth mentioning to overlap with, I'll suggest on 3 things I can explain another aspect of what I call integrative medicine or functional medicine. It's as follows. These scales given in medicine are so off. If you look at vitamin D on the piece of paper when the doctor hands it to you, it says vitamin D is appropriate and acceptable from 30 to 100. That's like, I use the analogy of saying, okay, it's like driving on the interstate. You're allowed to drive 30 to 100. You're going to have chaos.
Right.
So that automatically should show you that somebody doesn't know what they're doing or is not paying attention. So guys like me want optimal range. I don't want to just know you're alive. I want to know that you're thriving. So optimal range is, for instance, in vitamin D, like I told you, up in the 90 to 100. Let's take testosterone, for example. I've met so many patients, that normal scale goes from 240 to 1100. For instance, there's all kinds of little variances of that. But I've met many patients that came in with terrible fatigue and their T was 350. And they said, Doc, my doctor said it was normal. What do you think? I said, it's worth a trial, even if we give you a little bit of a low dose. So a lot of men suffer from hypogonadism or low testosterone as they age. So once again, you can't just use those scales. You have to discuss things with the patient, and thyroid's the same thing, that one of the scales goes from 0.4 all the way to 4.5, but the optimal range is 0.4 to 1. Right. So, and most conventional doctors are not aware of this.
Yeah, and the testosterone thing seems to be a big fad right now too. But the thing is, I think with women, they go through menopause, so they their levels drop rapidly during that process, where us guys were just sort of gradually going down and become grumpy old men.
You nailed it, and it's overlooked in both sexes. Each of these hormones has equal amounts of importance. Even some of the female hormones are important for men. So the concept of anti-aging has to be done with an eye towards multiple factors. So it can't be just taken on as a fad. You can't just be even as a physician, you can't just go to the latest, greatest weekend seminar. You have to have an obsessive passion for this.
Yes, which I've experienced with you. That's awesome. Is there anything else that you want to talk about in the integrative side of things?
Let's see. Oh, I think one last aspect that's probably worth talking about is I'm a big proponent of using what I call smart drugs. And that is repurposed drugs. So when a good-looking drug company agent like Ray or his wife comes in my office, even though they're not drug company agents, they look like Ray, they're all handsome guys. They come in and they give me samples. I immediately don't trust them. Okay? So why? Because they're just trying to sell me some kind of product that everyone will overlook the side effects for. Let's say Vioxx, for instance. When Vioxx came out, it was great. You can take this, it relieves pain, but on the back end, it was causing edema and cardiovascular problems. They had no problem hiding that data when they put the stuff out. Right. So having said that, I'll take 2 products such as low-dose naltrexone and rapamycin. They were patented for 2 specific things. Naltrexone to reverse morphine overdose and rapamycin for transplant patients. Ironically, when you give these 2 products at 1/10 the normal dose, whole different sphere, incredible, powerful anti-aging effects. So that's another example of what a holistic integrative doctor who's thinking out of the box does. I have many patients on those products with excellent success. So I do use the integration of patent medicine sometimes, but it's on my terms, not some drug terms.
Right. The other uses for it.
Yes. And there's a whole host of that. And another famous example right now out there, regardless of political spectrum, is hydroxychloroquine. It was created initially for malaria, anti-malaria, and recently it's been used a lot for rheumatoid arthritis, but it has powerful effects against the COVID situation. So
Right.
I'll leave you with that last tidbit of that's how a good integrative physician looks at these things.
Yeah, finding other ways to use it. That's awesome. They did with COVID too.
That's right.
I think do we have to wrap up here? No. Here, let's go. The last thing you talk about, mind and body, those two things together.
Well, I'm glad you brought that up. That's one of my personal favorite topics with my patients. I started delving into understanding this through a couple of different pathways. Number one, I started understanding yoga and doing yoga and meditation. I was intrigued by that. And then martial arts, the fusion of that. If you watch these Shaolin Kung Fu guys, and then there's these monks up near the Himalayas where they can do a tumo, it's called meditation, and wet blankets in 20-degree weather will steam off their bodies. Now, as a biologic scientist, I said, that can't be real. They took those guys to Harvard and studied them. So that got me looking into the mind-body relationship. Since then, I've become a devout meditator myself, and I teach my patients how important that union is. When you meditate, your brain is going into alpha, delta, and theta waves on an EEG. And what happens is you're releasing certain endorphins and immune modulating substances. So it helps blood pressure regulation. It helps the immune system. Even my cancer patients, I teach them while they meditate. I learned this trick from an oncologist to see their white cells defeating cancer cells and things like that. And it's well documented. A lot of these studies were done at the Harvard Mind Body Institute, that these techniques and tricks optimize our approach to health for patients. So in a nutshell, that's why I find it very important. And the last thing that I notice is a lot of these illnesses that patients have do stem from that mind-body relationship. So if I imprisoned you in a corner of a room and emotionally beat you silly, I could probably see that you manifest some type of disease process. And it was strictly because of that mind-body relationship and nothing else. So
right.
In a nutshell.
So that stress, all these other things which meditation would help with.
Absolutely. It's a phenomenal tool. And I teach the patients how to do that in the office very, very simply and readily. So that's something I love doing, because I've changed a lot of lives with teaching meditation. And it's not with drugs or anything. It's equally powerful part of the symphony, as I call it.
Yeah. No, you pushed it with Debbie's breast cancer. So that was a definite big help. Because mentally she was a lot stronger going through that process.
And maybe I'll try to be quick because I know we're running out a little bit of time, but I use this one example a lot. I learned it in pathology human behavior class, which is kind of psychiatry class in medical school, that our brains are so strong that there's well-documented evidence that when one spouse dies, within a year, there's a much higher frequency of the other spouse dying. So that makes you start questioning, wow, how can that be? Because it's clearly the mind-body emotional relationship. Another example that was in the media was when Carrie Fisher and her mom died within 3 days or something of each other. That just made me think of those things. It shows you how powerful that relationship is, so powerful it can cause you to die.
Yeah.
Life.
No, yeah, especially these long-term marriages and everything. So their will to live, their hope, all of it's taken away.
So
and then
the proof is right in front of us. It's just whether you want to, drink from the water.
Right. Yeah. That's awesome. Well, thank you very much for today, Dr. Rucker. It was very informative.
I really appreciate the invitation. It's been nice.
And if you people out there watching want to optimize, there's a ticker tape along the bottom with Dr. Rucker's information, his website, and his phone number. And we're going to circle back again because there's so many things that we can talk about. So I'm gonna bring you back on the show another time.
My pleasure. Love to.
This Friday, we have Chris from Trusted Pools coming on. He's going to give you 5 tips and tricks about renovating a pool, what you need to know when you're renovating a pool or starting a new pool. So look forward to that this Friday. See you tuned in. Thanks very much. And that's it for now.
All right. Thank you very much.
Talk to you soon.
Bye.
Bye-bye.